Hi everybody, I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. As usual, social media, which is filled with unqualified experts, including naturopaths, chiropractors, and medical influencers, like to ramble and pontificate about topics they know nothing about with the sole goal of selling products that are not FDA approved, their recently published book, or an expensive wellness plan. So one of the go-to topics is what's called leaky gut syndrome, which is real. So today I'm going to tell you what it is and what it isn't. Well, what is it? Leaky gut syndrome refers to a state of increased intestinal permeability, or the integrity of the gut epithelial barrier, which means the lining of the GI tract, in layman's terms, is compromised, allowing luminal contents, which is where the food goes, such as bacteria, toxins, and antigens, to translocate, which means to move, into the bloodstream. This phenomenon is primarily attributed to a dysfunction of what we call tight junction proteins that normally regulate transport across the epithelium. The concept of leaky gut syndrome is associated with both gastrointestinal and extraintestinal diseases, including inflammatory bowel disease, celiac disease, autoimmune disorders, and metabolic conditions. However, it's important to note that while increased intestinal permeability is observed in all these conditions, the causal relationship between leaky gut and disease pathogenesis is unproven in humans. There are none human randomized trials demonstrating that restoring the barrier function in leaky gut syndrome cures any underlying diseases. Current clinical management focuses on treating the primary disease rather than trying to directly target intestinal permeability, and this is supported by multiple reviews and expert consensus in the medical literature. There have been several randomized controlled trials and meta-analysis that have shown that interventions such as probiotics, prebiotics, synbiotics, and micronutrients like zinc can improve markers of intestinal permeability like zonulin, lipopolysaccharide, D-lactate, to name a few in humans, but these studies have not established that normalization of barrier function leads to resolution or cure of the associated underlying diseases, which we described before. The available evidence demonstrates improvements in surrogate markers of permeability, which I guess is great, but it does nothing in disease remission or cure. The prevailing consensus in the medical literature is that increased intestinal permeability is often a consequence rather than a cause of underlying disease, and restoration of barrier function may have adjunctive benefits, but it remains unproven that directly targeting and normalizing intestinal permeability cures the primary disease. Therefore, management continues to prioritize treatment of the underlying pathology, with barrier-targeted therapies considered investigational or adjunctive at this time. Factors contributing to leaky gut include alterations in gut microbiome, dietary components such as high fat or refined carbohydrates, infections, medications like non-steroidal anti-inflammatories, and inflammatory cytokines. The clinical relevance of leaky gut syndrome is an ongoing area of research, and there are currently no established guidelines for its treatment or diagnosis. So with that, I hope you learned something today. Thank you so much for listening. For more information or guidance, you can go to my website at www.paladinmds.com, and have a great day.